So let us begin with today's session of Alan's keynotes study streak, and we'll be discussing 4 to 5 remedies today. The first remedy being Colchicum autumnale. Now, if you have read Staph very well, if you have read Equis, Cantharis, and a few of other remedies which have dropsical conditions also like arsenic and epocinum and all, you will be able to understand colchicum in a better way because it is a distillation of all these remedies. So the first line that we read from Allen's keynotes is ailments from grief or misdeed of others. The first remedy which is mentioned in bracket is staph and the only remedy. So someone telling something bad to a person, and if their urinary organs, gastric system, or joints are affected, colchicum is the top remedy. If the throat is affected and the nervous system is affected, then staphysagria should be thought. Further down the line, you have adapted, colchicum is adapted to rheumatic gouty diathesis, persons of robust, vigorous constitution, and diseases of old people. So I explained that very clearly, and if you understand these finer differences, you will be able to be in a better position to prescribe. So sometimes you are thinking staph in cases of joint complaints, in cases of uh, you know uh, gouty people, uric acid diathesis, you should go for colchicum in those cases rather than be prejudiced and always think that staph, and I would only go for staph. So that is the nitty gritty things which you will be able to notice in your practice, and if you are observant enough about the lines mentioned in Allen's keynotes and what you see in your practice, you would be able to successfully cure these patients, or else you will be just palliating with staphysagria as the only remedy. Next, we have external impressions, light, noise, strong odors, contact, bad manners, make him almost beside himself. Other remedy mentioned in the bracket is Nux vomica. His sufferings seem intolerable. So, we know a very top remedy, which is aconite. Besides oneself with pain, lycopodium is another remedy. So, these remedies are something like they are so much absorbed in pain that they cannot share what is happening, what else is happening to them. In those cases, we should think of these set of remedies which are too much consumed by pain, and colchicum is one of them. So much sensitivity to pain, to touch, to noise, to strong odors, everything is there that he is, uh, you know, intolerably affected by it. Next, you have pains which are drawing, tearing, pressing, light or superficial during warm weather, affect the bones and the deeper tissues. When the air is cold and pains go from left to right, like we see in the cases. But what is more important is that pains are almost looking like phytolacca or colocynth or macphos, which are shooting, tearing, and pressing in nature. And main thing is that they affect the bones and the deeper tissues. So you have to understand the pathology when the patient reports to you, and you can probably go from the pathology to the remedy also if you are a good student of materia medica, if you are very much skillful in the use of repertory, because in repertory you will get lost. It's like a maze of symptoms. Similar maze is another maze is materia medica, and if you don't know what to pick up, what to make as a prescriptive pointer, you're going to get lost and keep on searching for the right rubric, the right remedy, and end up giving something else which is not even thought of in the beginning of the case. So you need to bring on table what you think in the beginning, what you think in the middle of the case, what you think in the end of the case, and what you think after the patient goes. So make those annotations in your case record, and that is going to help you further. And that is what we have over here, which is pains which are drawing, tearing, pressing, and they are affecting the deeper tissues. Bad effects from night watching. Top remedy we have and we know is cocculus, nux vomica, and a few of other polycrest remedies as well, like phosphorus can be one of the bad effects of night watching. But colchicum is also indicated, and the concomitant symptom which we'll always find in this remedy is that there is aversion to food, loathing, even the sight or smell of it aggravates. So I don't know how many of you have read Nash Therapeutics, but maybe sometime in future I would take it as a series of lectures like Allen's keynotes. But I must have visited almost 5 to 7 colleges in each state, and almost 50 to 80 colleges so far, or more than that. And I have always asked them, have the students, the interns and the practitioners have read, or the postgraduates have read Nash? Barely a few hands in few colleges turn up positively. The problem is that the students are stuck to the curriculum and the books which are mentioned in the curriculum and don't go outside it. But there is a very beautiful case of colchicum uh, cured by Nash in Nash Therapeutics. Just go and read it. And if you are lucky enough to listen to this lecture, to hear this lecture, and go to Nash Therapeutics, you will always remember that colchicum is a very beautiful remedy which was given by Nash after a series of 10 to 15 failed remedies in a case of dysentery. So it was this concomitant symptom which led Nash to prescribe, that is aversion to food, or there was more of loathing of food from the smell of the food in the kitchen next room from where the patient was located. Then you have affected parts are very sensitive to contact and motion, like we see in Arnica. And then we have gastrointestinal system, which is having acute smell, nausea, faintness from the odor of cooking food, especially fish, eggs, or fat meat. Arsenic and sepia are the top remedies. Wherever in cases of these presentations you think of arsenic and sepia, think of uh, you know colchicum as one of the remedies. It may probably cure your case if these remedies are getting stuck up or partially indicated. The abdomen is immensely distended, feeling as if it would burst. So there is a distension which cannot be explained by the patient, but there is a carbo like feeling, and there is no passing of gas, but only feeling is that they don't want food. Sometimes they will not be able to explain that the cooking food or the smell of food aggravates, but not wanting to have the food also may be on the lines of what the gastrointestinal symptom indicates with the distension of stomach. Burning or icy coldness in the stomach, this is a very strong concomitant. Some cases will definitely have this, especially in the stomach and abdomen. Autumnal dysentery, discharge from the bowels, contain white shreddy particles in large quantities, white mucus, scrapings of intestines. Other remedies, we saw one remedy yesterday which was cantharis. Carbolic acid is the other remedy. So there will be patients who will complain that when they pass stools, it's in a large quantity, or it's in, like, it seems that there is lot of mucus or lot of frothiness in the stools. This is one of the indications for shreddy particles in large quantities or in stools. Other indication can be that there would be seeming like patches of mucous membrane which have been eroded from those parts, and they are landing in the toilet seat, which indicates colchicum. In olden times, if you read all the source books, you will see that there are authors, there are stalwarts who have actually examined the stools and found out what the remedies to be given. I do that if there are pediatric patients. It gives us more chances for understanding the nature of stool. In adults, it becomes difficult because everything is excreted in the toilet seat and doesn't come back. But sometimes, if the patients are observant enough, we would be able to elicit these symptoms which are mentioned for shady particles in large quantities. Then we have urine, which is dark, scanty, suppressed in drops with white sediment, bloody, brown, black, inky, contains lots of putrid decomposed blood, albumin, and sugar. So you have to be in the last 2 3 days. We have been studying such remedies which have impact on the urinary system. And if you have patients who come with urine routine report and they have more of destruction seen in the urine routine report, you would be able to make out the remedy by asking just a few questions. And if you are keen enough to study the materia medica, you will be in a good position to ask the questions which give you the appropriate answers for deciding the remedy. Sometimes these patients are like level 1, level 2, like Dr. Sankaran says. They don't explain more about the disease or sensation, but just the name of the disease, the symptom, and that's it. In those cases, you will have to stop your thinking mind or case taking and just go on differentiating the remedies like a quick prescriber and go further. So urine routine showing lot of destruction, decomposed blood, casts, crystals, albumin as well as sugar would indicate colchicum, and some other remedies which are based upon those lines. Arthritic pains in the joints, patient screams with pain on touching a joint or stubbing a toe. This is almost like arnica. And if you have examined or seen arnica patient, you will probably, with this modality of aversion to touch, you will understand how important this symptom is. Similar presentation is also there in Kalikab, but in Kalikab it's only the soles which are sensitive and not the entire limb. In Colchicum we see it's mostly the joints. The joints may be swollen and they don't like to be touched. In Bryonia they would prefer touch, or they would even tie and come to the clinic, or they would say that they tie their joints in the home to make themselves feel better. Aggravation, we come to the modalities of colchicum: mental emotion, exhaustion, effects of hard study, students who are studying day night for their exams as a crash course, they would need this remedy. Bad effects of loss of sleep, we saw that. And they will have some gastric symptoms or some sort of small symptom from the mind. And odor of cooking food aggravates colchicum. And every motion kind of renews the complaints which is mentioned. So next we have comparison, which is bryonia, and very similar remedy, but only difference is that here there is aggravation from touch. In bryonia there is better by strong pressure, and it will be rheumatism in warm weather for bryonia, whereas here it is the different weather conditions. And if you have given apis or arsenic and have failed, or if you are thinking of dicey between thinking of arsenic or apis, think of this remedy colchicum, and it will probably cure many of your rheumatic joint complaint patients who have more staphy's area like feeling, rather than beating around the bush with staph or arnica or bryonia and landing nowhere and probably even palliating the patient. There is a new trend among homeopaths which I want to tell to avoid, and this is more like giving uh, the medicine according to the name of the medicine is exactly same to the name of the disease. For example, if there is cartilage damage, they give cartilago, or rheumatoid arthritis, they give rheumatoid arthritis as a RA disease, or RA medicine. These things will just palliate the case, but the real cure will happen by these polycrests. So think about those medicines only in severe cases or as an intercurrent, but they will not kind of cure the patient. If you want cure, the polycrest mentioned by our stalwarts are going to be the ones that will help you. So the next remedy, which is very similar to colchicum, and it is not mentioned anywhere in this, but I made my own notes in the last 15 years of my experience, and I saw that it is also very similar to terebinthina. So we'll go to terebinthina and we'll uh, read that remedy. So this remedy terebinth is, you know, also has congestion and inflammation of viscera, kidneys, bladder, lungs, intestines, uterus with hemorrhage and malignant tendency. So this is like an oil of turpentine which is going to affect all the parts of the body and causes a malignant tendency. The tongue is smooth, glossy, red, and is deprived of papillae. So those cases where we see it's a bar tongue, which is also present in nutritional deficiencies like vitamin B12, or it is as if glazed. The other remedy mentioned is pyrogen. In those cases, we can think of terebinth as the remedy, or there will be elevated papillae coating peels of in patches leaving bright spots. So you see that in terebinth also the remedy kind of peels off the mucous membranes, which is almost similar to colchicum, which is almost similar to cantharis, and you will see a picture of cantharis coming somewhere down the line in this remedy, and that is what kind of gives you the impression that maybe this or maybe that, maybe this and that, and you will be able to decide terebinth on the indications of its malignant tendency, if it has affected lot of organs, or the destruction is so profound that it's not something that you will think as the first remedy, but you will probably or it will not be some patient who has landed to you immediately and you will think of that remedy, but you will probably come to this remedy after the pathology has progressed, or after the condition has progressed too much and the patient has landed to you. So then we have in the tongue that the entire coating cleans off and there is dry and red burning in the tip, and which is similar to muriatic acid. So recently I had a case where I seem to be getting confused between many remedies, but this kind of bile tongue led me prescribe muriatic acid in the case of cirrhosis of liver. So maybe some other time I would be able to share the symptoms if everyone is tuned into the live and my sessions. Next, we have for terebinth in Allen's keynotes, purpura hemorrhagica, fresh ecchymosis in great numbers from day to day, like the remedy sulfuric acid. So, if you see that there are two acids mentioned so far, muriatic acid, sulfuric acid, you need to prepare a line of thought in your mind, and that line of thought is that this remedy has its action almost like the acids. Not being an acid is uh, and having the qualities of acids should make you think of, should make you ponder about the qualities of these remedies and how it is going to affect the system. So everywhere you see that there is a destruction which is going on, and two acids are mentioned, and down the line you will see even more destructive remedies which are mentioned in comparison. In those cases, you can think of terebinth as the remedy. Next, we have gastrointestinal system, which is abdomen, which is extremely sensitive to touch, which we saw in colchicum. The next remedy mentioned in bracket is colchicum. Distension, flatulence, excessive tympanitis, meteorism. So this also may be more like concomitant symptom in many of the patients in cases of any grave pathology, and you would be able to prescribe terebinth on these indications that the stomach is distended and there is a malignant pathology. Then we have diarrhea, which is having where the patient has stools, watery, greenish mucus, frequent, profuse, fetid, bloody, burning in the anus and rectum, and fainting and exhaustion after the stools have passed, which almost seems like arsenic, the next remedy mentioned in the bracket. So arsenic would probably be indicated in wide range of action, left, right, and center. All homeopaths have been giving it, and in mind system they have been giving it for carried desire to be too fast or rest cannot when things are not in proper place. But if there is a grave case which would say that there is, where the patient would say that there is lot of weakness and lot of drowsiness after the stools have cleared, think of terebinth. But before even terebinth, you should think of veratrum album also, which is one of the often ignored remedies in such cases of diarrhea. Then we have worms in terebinth, and I think it is one of the top remedies mentioned in many places for worms. It's very surprising that such a remedy which has grave pathologies can be mentioned for worms, but the amount of destruction that worms cause is not evident externally. That is why it is often undermined condition. Worms with foul breath, choking, sina and spigelia are the other remedies. Dry hacking cough, tickling at the anus, ascarides, tapeworm segments are passed. So worms are a condition where the homeopath has to struggle a lot. A single dose of albendazole, 6 months duration is what allopaths do, or even 3 months is what allopaths do, and they get good success at it. But homeopaths, I don't know how many of homeopaths cure worms and actually bring out the worms. You need to give skirinum 30 intercurrent if you need to cure the worms or bring them out. Number one. Number two, the small remedies that we have scattered across in the materia medica, which is Ignatia and Spigelia and Sina. Terebinth is one mentioned here, and lot of other remedies. In Boric, there are around 50 remedies mentioned for in the Boric repertory for worms. Similarly, in other repertories, there are many remedies mentioned. So you'll need to give based upon symptom similarity, but Skirinum 30 or 200, one dose every 15 days would probably give a push to that remedy in the positive direction and bring out the worms. Hemorrhage from the bowels with ulceration, passive, dark with ulceration, or epithelial degeneration. So, if you see that in the beginning there was mentioned that there is malignant tendency, you have to understand that everywhere there would be destruction. Some patient landing with reports which are very grave. The destruction has started. Think of this remedy, or the destruction has progressed. In the urine, you will see that many patients will complain that there is a very sweet or good smell which is coming, like that of a flower. That can be a good indication for prescribing terebinth. The urine has the odor of violets. There is hematuria, blood thoroughly mixed with urine, sediment like coffee grounds, cloudy, smoky urine, albuminous, profuse, dark, black, and painless. Then you have ascites with anasarca in organic lesions of kidneys and dropsy after scarlatina. Apis, helleborus, and lachesis are the next remedies mentioned. And in ascites, this remedy would be indicated when there is hemorrhage that has happened in the bowels or in the stools, which are reflective of the malignant nature of the disease. And similarly, we see the malignant nature of the remedy to be indicated. You then have violent burning and drawing pains in the kidney, bladder, and the urethra. Same we see in Berberis, which is the next remedy that we'll be covering. Cannabis sativa and Cantharis we covered yesterday, which have similar presentations, although not in such grave form throughout the remedy which we see. There is violent burning and cutting in the bladder. Tenesmus, I already explained about tenesmus in many other remedies. If you wish to understand how will the patient would express, you may need to go and understand that from those remedies. And then you have which is something which is cystitis, which keeps on happening. Some patients keep on having recurrent urinary tract infection. In those cases, you can think of terebinth as a remedy. Sensitive hypogastrium, lot of pains in the lower abdomen all the time with urinary infection can make you think of this remedy. But I would suggest that if you get a urine routine done, if it shows some casts or some blood in the urine, then you would probably be in the right position to think about this remedy. And there is albuminuria, acute in early stages when the blood and albumin abound more than the casts in the epithelium after diphtheria, scarlatina, or typhoid. So, any infectious disease that has happened to the patient which has resulted in pyelonephritis, acute pyelonephritis, terebinth is going to be the top remedy which you should think of. Urine is rich in albumin and blood, but very few if but less urine if there are any casts, especially aggravated in damp weather. There is strangury, spasmodic retention of urine. So something is stuck in the urinary passage and causes retention of the urine. It can be a malignant growth, it can be a stone also, it can be some other pathology which is obstructing, some other swelling of the organ which is obstructing the flow of urine. In those cases also we can think of terebinth. You need to compare terebinth with alumen, arnica, arsenic, cantharis, lacasis, and nitric acid. And if the patient is traveling to African countries, you can give this as a prophylactic remedy for 3 days OD dose and maybe stop it. In India also there are some marshy areas where such conditions exist like malarial and some sort of fevers. In those cases we can give this remedy as a prophylactic. And next we have is the remedy berberis. So, if any one of you have had attended my renal calculi workshop, you would probably understand how beautifully this remedy has helped, bring out a stone within a few hours, like say 2 or 2.5 hours. So, this remedy is having pale and earthy complexion with sunken cheeks and hollow blue encircled eyes. Now, this is disposition and face which is mentioned by Ellen. You may probably get or you may probably get more of physical complaints. This would be probably indicated for subacute and chronic conditions if ever you wish to think about prescribing on these cases, on these indications. Next, you have is rheumatic and gouty complaints with diseases of the urinary organs. Renal or vesical symptoms predominate. So there can be some affection in the kidney, ureter, or bladder, or the urinary tract, urethra further. Think about berberis in those cases. There will be constant pain in the lumbar or the surrounding areas of kidney, the small of back which is mentioned. Very sensitive to touch in the renal region and aggravated by sitting and lying, from jar, from fatigue. So every condition that you see is kind of aggravating. In fact, in boric, if you go and see, there is just one modality which is mentioned, and that is aggravated from every position or worse by any kind of position. No position makes him give relief. So that is berberis. Actually, the patient will be restless. You will probably think that you need to give aconite, but aconite does not work in such cases. It may calm down the anxiety but may not actually bring down the stone. In rare cases it may do help, but if you know that the stone is present, there is urinary trouble, there is urethral complaints which the patient has been complaining or suffering from, think of berberis. Give it as frequently as you can, maybe every 10 minutes, every 15 minutes, every half hour. You will see the result in the clinic only if you make to sit the patient, or probably if they go home, they'll call you up in an hour or two that the complaints have gone and maybe the stone has also come out. Then you have burning and soreness in the region of kidneys, numbness, stiffness, lameness with painful pressure in the renal and the lumbar regions. If you have a patient with chronic kidney disease and if he has these same complaints, which is, the small of back is painful and in those regions there is a dull kind of pain, the remedy that you should think of giving is solidago. If it is acute and subacute, think of berberis, but in chronic kidney disease, you should think of solidago as the remedy. It would probably help relieve the pain and also ease the condition of the kidneys. There is stitching, cutting pain from the left kidney following the course of ureter into the bladder and urethra, like the remedy tabacum. If it is right kidney, think of lycopodium, which is almost a specific for renal calculi. If it is left kidney, think of berberis. Also in right kidney, you will have sarsaparilla, which is the next remedy which we will cover. Renal colic aggravated left side, and if there is constant desire to pass the urine on any side, there is a stone, and kind of a bloody or brownish urine, think of cancerous in those cases. There is some vague sensation, that is bubbling sensation in kidneys. This is only for the examination that we have memorized. In clinical relevance, patients may or may not be able to complain about these sensations. They just want relief quickly, and modalities are going to be your stronghold prescriptive pointers rather than the sensations. So try to understand from the clinical relevance about what is written, and from the academic relevance what is written. It is, a difference of, you know a lot of difference from top to bottom. Then you have conditions where there is urine which is maybe greenish, blood, thick, slimy mucus, transparent reddish, or jelly like sediment. So, some cases of urine complaints will give you, some patients will give you these complaints. You may probably get it in urine routine examinations also. And you see the main symptom which is mentioned next, which is movement brings on or increases the urinary complaints. Next, you have is colic from gallstones. Now, I bet no one knew this, but if there is a case that lands in your clinic with kidney stones and gallstones, give Berberis vulgaris 200 or 1 m potency every week, one dose, or maybe every 15 days, one dose. This is going to help the patient a lot locally for the local organ. In one of the repertories, I believe it's complete or reliable repertory, where there is only mention of berberis as the single remedy for gallstones with kidney stones as the rubric. Although clinically, if you see, there may be many remedies for presentations where with modalities, with concomitant symptoms, etc. But if we see from the repertory point of view, this is the only remedy which is present in such a rubric where the combination of kidney stone and gallstone is mentioned. So I'm just talking from the repertory point of view, but from the prescriptive point of view, you may come to many group of remedies, and it depends from homeopath to homeopath about how he wishes to undertake patients in the clinic. Next we have is bilious colic. So berberis is often undermined for gallstones, but there is bilious colic, there is jaundice. So you see there is gallstone in a patient who brings sonography report, and there is jaundice. So it's an obstructive jaundice. Think of berberis as the remedy. It is going to ease off the pain and the complaints, and there would be all the conditions which are there in jaundice: clay colored stools, and the icterus which is yellow, the weakness, the loss of appetite. But there will be, along with that, there will be itching of the parts, some chest complaints, and if the patient comes to you uh, with some history of fistula or fistula like complaints, then it is more even indicated in a better way. The other remedies being calcarea phos and silica. Aggravation, we come to the modalities where berberis is mentioned for motion, walking, carriage riding, or any sudden jarring movement. So the patient needs to be still, or he needs to find a position to relieve himself because nothing relieves him. That would indicate berberis to you more than the different sensations which have been mentioned. They are useless, I would say, from clinical relevant point of view, because not every patient would give you sensation, but every patient would probably give you modalities which give you more insight into prescription than the sensations which may be available from 1 in 20 or 1 in 50 patients. So next we have is similarly, similar action of berberis we see is cantharis, lyco, sarsaparilla, tabacum in renal colic, and berberis acts well in arnica, bryonia, calibicromicum, rust ox, sulfur in rheumatic affections. So next we cover the remedy which is sarsaparilla, very similar to berberis, but it has its own way of working, and especially cases where there is right ureteric stone, you can think of sarsaparilla. For dark-haired persons, lithic or psychotic diathesis, sarsaparilla from Allen's keynotes is mentioned. In children, face is like old people, enlarged abdomen, dry and flabby skin. So if it is mentioned that it can be indicated for children, you can understand there will be a certain class of conditions where sarsaparilla can be indicated for children, and it is not exclusively for patients with kidney stone. The other remedies which have similar presentation, which is enlarged abdomen or old looking face, is Baraitacam and opium. In fact, many times you will see lycopodium also having early premature growth in children or adults. There is great emaciation, skin becomes shriveled or lies in folds. Abrotanum, iodum, natramur, and sanicula are the other remedies. We already discovered all these remedies in Allen's keynote in the past sessions. Next, we have rheumatism, bone and periosteal pains after mercury or checked gonorrhea, pains aggravated at night and in damp weather or after taking cold weather. So you know that the conditions are getting damp and there is a patient landing to you with rheumatism. Think of sarsaparilla. Other remedy that you should think of, and it is only mentioned in Nair's repertory for joint pains in damp weather. The remedy is Calcarea fos. So next we have is urinary system, which has many complaints indicative of prescribing sarsaparilla. Severe, almost unbearable pain at the conclusion of urination. Berberis, equisetum, medorinum, thuja can also be thought. Passage of gravel or small calculi, renal colic, stone in the bladder, bloody urine. So all those pathological conditions or bordering on pathological conditions from the functional part, you can think of sarsaparilla. Urine is bright, clear, but irritating, scanty, slimy, flaky, sandy, copious, passed without sensation, deposits white sand. Now, getting a white sand deposit is difficult, but everything else is possible. It will be in large quantities. It will be also having some sandy deposits, or in the urine routine you will find that there are some crystals or calcium oxalate present. Other remedy being causticum. Painful distension and tenderness in the bladder. There is urine which dribbles while sitting, standing, and passes freely. While standing, I think it passes freely. I've never encountered this symptom, but there is also air which passes from the urethra. Sand in the urine or on diaper, child screams before and while passing it. Similar remedies we'll see borax and lyco. Many children having urinary tract infections or urinary complaints will cry during or before the passage of urine. Think of sarsaparilla in those cases. Then you have sexual disease, that was gonorrhea, not so much evident now, which used to happen aggravated by cold or wet weather or mercury and then causing rheumatism. There is fluid pollutions, bloody seminal emission, leadum pal and mercury can be indicated. And the female reproductive system mentions retraction of nipples. Nipples are small, withered, unexcitable, like the remedy silica. In the skin, one of the many places where many conditions where sarsaparilla is often ignored is skin. So there is herpetic eruptions. If you are thinking of prescribing hepar sulf or graphitis, or you are confused between hepar sulf and graphitis, you can think of sarsaparilla for prescribing, because there are herpetic eruptions on all the parts of the body, ulcers after the abuse of mercury, or in syphilis cases, rash from exposure to open air, dry itch-like eruptions prone to appear in spring and become crusty, and itching eruption of forehead during menses like Eugenia jambusa, sanguinaria, or sorinum. So as I already said that earlier also in many sessions, that Allen's keynotes would probably give you more physical particulars and physical generals. These are the your foundations for prescribing, and one of the main indications for prescribing sarsaparilla would probably be this itching eruption on forehead before menses or during menses. This would probably more indicate to give sarsaparilla as a constitutional or subacute remedy than the other remedies. And then there will be some skin complaints also, like there are cracked skin on the hands and feet, and there is hard and induration of those parts. So now we come to the complementary relationship where Merck and Sepia are mentioned, any of which will follow well. In fact, there is a very beautiful cycle of sulfur, sarsaparilla, and sepia. In all those cases where you think of sepia, you should follow it up with sulfur. In all those cases of sulfur and the skin is not getting well, try to probe whether it looks like sarsaparilla or sarsaparilla like indications, and you will probably land up giving it. So it's a kind of a cyclical remedy like the remedies calcarea, lyco, and sulfur. And similarly, we have sulfur, sarsaparilla, and lyco in this order. And you can also compare sarsaparilla with the other ureteric remedies, which is or kidney, ureter, bladder affecting remedies, berberis, lyco, and then the other remedies which are polycrest, which is natramur and phosphorus. So we covered almost four remedies today, and now we cover the very small remedy which is very much neurogenic in origin in its complaints on the bladder. The remedy being equisetum. So why is it neurogenic? Because we'll we'll just come to it in a few minutes. There is mentioned in Allen's keynotes that there is severe dull pain in the bladder as from distension, not better by urinating or not better after urinating also. Frequent intolerable urging to urinate with severe pain at the close of urination, like the remedies berberis, sarsaparilla, thuja. Constant desire to urinate, large quantities of clear water urine without amelioration. If it is scanty urine, think of Apis or Cantharis. If it is large quantities, think of Sarsaparilla or Equisetum. Sharp, burning, cutting pain in the urethra while urinating. Paralysis of bladder in old women. So, this is the first line which makes you think of neurogenic bladder or neurological complaints with the bladder symptoms to prescribe equisetum. Next we have is enuresis diurna et nocturna, which is nocturnal enuresis in short, and many cases of nocturnal enuresis in children will probably get better with a dose or two of equisetum, or you may need to give it just before sleep in 30 or 200 potency for a month or for 15 days, and you will see the result. Of course, this remedy should be tried after you have tried the constitutional, because it has a small action on the bladder. If there is a known cause which we see, if it is from dream, if it is from shout of the parent, we should think of those remedies on those lines. Many polycrests have their scope for acting on nocturnal enuresis, but if everything has failed and you have no other reason seen, then you can think of prescribing equisetum. There is a rubric in Kent repertory. Go to bladder. The rubric is bladder, involuntary urine at night, uh, without no tangible cause except it being a habit. There is only a single remedy, which is equisetum. So, in those cases where it has become a habit for the bladder to pass the urine at night without any known cause in children, without any weather affection, without any, without any incident which has happened in the children or the life of the child in the throughout the months which we probe, then you should think of equisetum, where there is profuse water urine, where habit is only ascertainable cause. And I also told you the rubric. So go in Kent repertory and look at that rubric, and you will never forget about this rubric. We can compare equisetum with the remedies Apis, Cantharis, Ferrum Phos, Pulsatilla, and Squilla. So if you think of equisetum, think of these remedies, or if you have thought of those remedies for prescribing, think of equisetum. It will make your ability to prescribe in a better way. And that brings us to the end of today's session of Alan's keynote study streak. I think it was day 31 or 32, I don't know. but we have almost finished 100 remedies and some 80 more remedies to go. So anyone have any questions, please feel free to drop by and we call it a day afterwards. Okay, so we are almost. So I think no one has any question. Everyone is very studious and everyone is very uh, learned enough to not ask any questions. So let's call it a day, and we'll meet up again tomorrow 5 p.m. with another set of few remedies to finish Ellen's keynotes study streak. So thank you all for joining. Okay, before I move, I saw one question. Can we do some rubric as well as with the remedy? Vital healing, yes. So I have some few more ideas. In fact, many ideas. I probably belong to the Coffea as a remedy Rubiaceae family. So there are many ideas which are coming up. If you are following the page, if you are following my YouTube channel, if you are following my Facebook page, you would probably get an idea of what's coming next. So there is a different kind of learning which everyone will experience if they are following me. Something will be routine, something will be in a better way, or maybe presented in a clinical way, practical way. So I will definitely take the rubrics also. There are a lot of things, but I wish to undertake Alan's keynotes first, and then maybe the other things will follow. So yes, to answer your question, we will have some more of rubrics in the down the line. So I will definitely cover that in future. But right now, my focus is to finish Alan's keynotes and some ideas about different presentation of these remedies and how they will, how much relevance and how will patients explain to you clinically, and some cases that I have solved or used these remedies or have used these prescriptive pointers which are mentioned in Alan's keynote. So it's a very good book which I think you should be thorough with, just like how you know your friends, your colleagues, and everyone. You should know these basic books by heart. So let's call it a day, and thank you all for joining. And we see again tomorrow 5 p.m. rather, not 6 p.m. 5 p.m. Ellen's keynote study streak, day 32 or 33, I believe, and we'll take up next few set of remedies. So till then, bye bye.